So I'm Iqbal Malik, and this is Jerome, who is one of my patients and has very kindly agreed to speak about his experience. And it is quite an experience, Jerome. So first of all, thank you for agreeing to share your story. Tell us about the fateful day. When was it, and how did you come anywhere near Iqbal Malik in a hospital?
Yes, indeed. So it was on the 20th of November 2023. And in the morning I felt absolutely fine and followed my usual routine, absolutely no issue whatsoever. And then in the afternoon, I started to feel lightheaded. A very unusual feeling, I would say, but no pain. But I started to feel that I was losing balance. I really didn't know what it was, so I thought, well, I'm just going to lie down on my sofa. I was working from home on that day, and well, it's probably going to pass away. But then, it was so bizarre, such a bizarre feeling that I thought, it's probably better for me to check it out. And I live not far from St. Mary's Hospital in London. So I thought, well, I'm just going to walk to the hospital, really, and we'll see what it is. I'll go to the A&E department. Started to walk down the street, and oh, again, I thought, oh wow, I'm going to faint. I mean, I'm starting feeling some pain as well. So I decided to take a taxi, and I remember being stuck in the traffic and feeling, oh wow, and the pain and this the fact that I felt that I was about to lose consciousness was very pregnant, very prevalent. And I remember being really, I was actually on my knees in the taxi because I could, somehow not sit properly. Why? But I was really unwell. And the taxi basically stopped by the A&E, and I thought, oh, I'm never going to be able to walk up this ramp. And there was a big ramp, to go up, the to the A&E department at the St. Mary's Hospital. And I thought, well, how am I going to reach there? And I started the ascent. I don't recall anything else.
In the A&E department, you actually had a cardiac arrest. And so you were resuscitated from that cardiac arrest. And then it clearly transpired that you were having a heart attack. And so a heart attack, just to explain the difference in a heart attack and a cardiac arrest, because some people say I've said the same thing twice, is that a heart attack is a blockage in one of your blood vessels. And a cardiac arrest is when your heart stops. And one of the common reasons why your heart can stop is because the blocked blood vessel leads to a rhythm disturbance. And that's what happened for you. Now, had you done that at the bottom of the ramp and not been in the A&E department, this is London. People will step over your body almost certainly because they think you're drunk rather than actually helping you out. That's London for you. But because you did it in the A&E department, it was a witnessed cardiac arrest. Number one, you could get resuscitation, because that resuscitation, that people jumping on your chest, it's not going to restart the heart, but it keeps your brain and your body going. So you got that. And more importantly, defibrillation, where the defibrillator is immediately available. So we have, obviously, in open spaces, in restaurants and hotels, automatic defibrillators. But then someone has to get it out and fit it to you. In an A department, obviously, there's loads of them. So you chose exactly the right spot to actually do it. The only place better than that would have been the heart attack center itself, which for us in the Imperial Group is at the Hammersmith Hospital. So you had a period of resuscitation and stabilization there, which you don't know anything about because obviously you were intubated, ventilated, sedated to try and get some stability. And then you had a critical care transfer to the Hammersmith Hospital, which is the heart attack center. So London is blessed with 6 heart attack centers. Every big heart attack can get to a heart center very quickly, and London Ambulance is amazing at transferring patients. And so that's exactly what happened. And you entered into the hospital at the Hammersmith Hospital. We were expecting you because St. Mary's is alerted, and you ended up having your artery opened up, but of course you were still intubated and ventilated. You still had this period of cardiac arrest, although with good cardiopulmonary resuscitation, we were hoping that the brain would recover. So all of that work has been done, and your heart is much less likely to have another cardiac arrest because your artery is now open rather than closed. The muscle is now not feeling so irritable, because a cardiac arrest is really the muscle getting so irritable, it goes into what's called ventricular fibrillation. We've all seen it in the movies where Tracy is doing that. That's ventricular fibrillation, and an electric shock resets that. But it'll happen again unless we open the artery. And we did. So the heart is looking as though it's going to hopefully not do that acute cardiac arrest thing again. But now we're in that phase where the heart's had a big kicking because the artery was blocked for a bit. And who knows what's going to happen to your brain. So you're taken to the intensive care unit. What do you remember next?
Yes, I mean, it's a big black hole, I must say. So when I wake up, first of all, I have lots of hallucinations. I don't think that I'm in London. For some reason, I believe that I'm in Spain. And I'm telling my wife that actually I'm very surprised that everyone talks to me in English, and that their command of English is fantastic for a Spanish hospital. And I see Spanish flags across the windows, etc. So obviously this is not the case, and lots of nightmares. So I realize that I have plenty of tubes on me, and this is the first thing that I start to comprehend, is that I've got at least 10 lines on me, and it's hard to imagine, but yes, on your obviously your neck, your nose, your arms, etc. So it's you can't move at all. Then it's very late in the process actually that I start to realize the gravity of what happens. It's only 3 weeks in ICU that some consultants came to me and said, "Well, you see, what happened to you was absolutely serious, very, very serious. You had a near-death experience." I was absolutely shocked. I really didn't, because obviously for 2 weeks or so I was in an induced coma, so I didn't know what was going on. Step by step, I had to learn how to breathe again by myself, and that was quite a challenge. I remember, the very first day, I was told, "Well, you'll have to breathe by yourself for an hour." And I remember showing with my hands the number 2. I said, "I'll try 2 hours." And then on the first day, I managed to breathe, for 2 hours by myself. And then we started increasing the targets every day. And then after some time, I could be off ventilator. That's right. And then I started also to learn how to swallow again. And that's a complicated exercise, I must say, because you don't realize how simple it could be, to lose the ability to swallow. And it seems that the muscle becomes quite lazy after some time. And I had to take a number of, for example, tests, biscuits, ice cubes, to see if I could swallow again. And that, so it was, for some time. And then I had to learn how to walk again. And I remember my very first objective was to go from my bed to actually try to get up and stand up and go from my bed to my chair. And I realized during this period as well that I had lost the ability to write. For some reason, I couldn't write at all, and it was very challenging to interact with the nurses and the doctors, because I couldn't really talk. I couldn't write. and I was given an iPad sometimes to express myself, but it was almost impossible to type in anything. So
Mm.
yeah, quite a challenge to interact with your environment, I must say.
This is great to hear because in the midst of all the success, we often forget that you as the patient is having an incredibly poor experience because you're a high functioning individual at the top of your game, and suddenly you are completely invalided and you've lost the ability to communicate properly, to speak properly, to write properly. I'm sure even the iPad was a very foreign technology at that time because you have to try and process how you use it. Now, a 3-year-old can use an iPad because they're grown up with it, but this is such an insult to the brain that you're having to learn to do almost everything all over again. And so, obviously, given that you're talking to me now, there's a success coming up. So,
That's right. And then I move on to wards in the hospital, really. And again, here I'm continuing to learn how to walk and swallow and write and talk. And yes, my voice is very hoarse, so I have to practice, talking. And then I will be leaving 4 weeks after the accident, really.
so a total of 4 weeks in hospital, but you walked out of hospital, yes?
Yes, I did. And
Yeah. Okay.
was extremely proud.
Mm,
And it felt like an incredible journey because I had to, again, learn everything from scratch.
mhm. So tell
And
me, who's at home with you at that time? So what's your social care package at that time?
yeah, so my wife will take care of me at the time. She'll come and collect me at the hospital. And yes, and I feel very confident. I feel very happy. But then, obviously, the question is, what can you do by yourself? And I'm still having lots of nightmares at home, and actually it carries on till now, I must say. I'm anxious going out by myself because I'm wondering, okay, what if it
Mm,
happens again?
of course.
And for the first couple of weeks, I must say, I love going out. I admire everything. I think that everything, everyone is beautiful. It's
Joie de
um,
vivre, joie de vivre.
absolutely,
Mm,
absolutely. But I need my wife to come along to
mm.
support me. I don't have enough confidence, if you will, to walk by myself down the road, really. And then step by step, we'll start, trying small things. So go to the grocery by myself, grocery store just next door, etc. And then having more ambitious targets.
Okay, so we've got to you getting some target. Just before you left hospital, did the occupational therapist do any sort of brain testing on you to see if you were going to be able to cope at home? What did they do? Can you remember?
Yes, I do remember. They conducted a number of cognitive tests. So lots of questions, drawings to see if I could understand some fairly basic questions. Remembering also some the order of certain objects or addresses, and then had a number of challenges that I had to complete by myself. So typically, going to the store of the hospital
Mm.
and finding a number of items by myself. And I remember I was timed in the meantime and observed, and also calculating the price of multiple items. So I was really happy to be able to get the arithmetic right.
So the test really is of your spatial awareness, of your ability to remember, of your ability to do some simple arithmetic, and then of your ability to get back and deliver the answers. And obviously they are watching you from afar, so you don't wander off onto the street. But it's a great sort of multifunctional test that you passed there before you went home. So that's useful.
Hammersmith Hospital is quite a complicated place to navigate, I must say. And so finding the store in the hospital is far from being easy, for sure, even if
No.
you haven't had a cardiac arrest.
The nightmares, as you say, even in 2025, you still have nightmares at night. The hallucinations, I presume, have stopped.
Yes.
Okay, thank God for that. So I think then the next thing is, look, you've still got a life to live. What job do you do?
So I'm head of research for a big tech firm in the UK.
Okay, and so that is a high pressure, high functioning job. And the great news is you said I am, and therefore you're still doing the job, which is great. How long did it take you to actually get back to work?
Right. I resumed work 4 months after the accident. And I felt it was the right timing. The firm I was working for was very understandable, and they really asked me to take my time, and I think it was the right amount of time. I really missed work
Mm.
for sure, but at the same time, I needed to be able to perfectly fine to sit at the desk and interact with others. And what I found really tiring actually was the interaction with colleagues and clients. After some time, I would basically leave a meeting early because it was too tiring, and I felt some the fatigue in my brain, if you will, to some extent.
Mm. Well, so that fatigue is actually very common after stroke as well. So clearly your brain had a bit of an insult, even though you were resuscitated very quickly. And partly it's being on intensive care unit for so long, that'll have an impact. But partly it's the brain having had a bit of an insult. Even if your MRI scan was practically normal, there's still a degree where the blood supply has been lacking, and the brain takes quite a long time to recover. The amazing thing is it can recover and you are
Mm.
back at work, but it can take time. And so you mentioned it was about 4 months since the event before you managed to get back to work. And then have you chosen to go back full time to work, or are you doing sort of less than full time?
So less than full time. I'm working 3 days a week, and so it's been the case since the return to work, really.
And I think, some people would be able to get back full time, but I suppose there are two elements to that. One, there's always a physical limitation, but also I think an event like this makes you sort of reevaluate sort of life choices. So are you holding back to 3 days a week because you physically can't do 5 days a week, or are you holding back to 3 days a week because you've decided to have a different work-life balance after this?
Right. No, actually, I'd love to come back to a full time job. The challenge I have is really the fatigue still. Just a few weeks back, actually, I was so tired at the end of this back to back series of meetings that I could hardly stand up and leave the office. So the fatigue is still there. The fatigue
Mm.
still. So if there is one thing that has carried on, is this one, and I feel that the concentration issue is still there as well. I used to read very long novels, and I find it a struggle now to
Mm.
to concentrate for very long.
What about your physical capacity to finish off with? What can you physically do?
Well, I think I'm probably 80% there. I love walking, so I try to walk as much as I can. Sometimes I go to the pool to exercise as well. I feel that I'm in a good shape.
Mm.
I might have some the
Mm.
body aches sometimes. Probably the effect of statins, I suppose, but not something that is unbearable, really.
Okay, great. So physically, you've made a good return. Are you a sort of gym guy? Do you sort of pull weights and things in the gym? That's not you.
I really enjoyed the NHS cardiac rehab sessions,
Mm.
and they were absolutely astonishing, I must say.
Mm.
And because it was not solely learning again to use your body, it was really regaining confidence. And
Mm.
and I had fantastic support from the NHS here, I must say.
So
And
from the rehab point of view, I'll make the point that rehab is known to reduce your risk of dying. So this chat and the confidence that they give you is proven to actually be as good as one of the tablets in making sure you don't have another event or you don't dive into a deep depression. You see other people who've recovered, the nurses are very confident in giving you a graded program that's suited to you, and that's really worked for you. So that is really, really good news. Obviously, you're left with quite a few tablets to take to prevent this happening again. So if I summarize to say, listen, people are watching this are going to say, well, clearly this chap who, how old were you when you had when they had the heart attack?
49.
Yeah. So this 49-year-old, listen, he was misbehaving. He must have been smoking. Were you?
No.
No. He must have had diabetes. Did you?
No.
He must have had high blood pressure. Did you?
No.
No. There's a strong family history. Everyone in his family is dying under the age of 60. Is that true?
No, my father is 91.
Yeah. And so, and also your cholesterol was not high. So there you are, really looking like a low risk individual. And what's happened to you is that there's a very minor plaque, a very minor furring up in one of the arteries that chose that moment to blow. And so when the top comes off that volcano, the lava, the clot, basically blocks the whole blood vessel. And that's what happens. So a very small plaque that wouldn't be giving you any problems walking around, it's not going to cause angina or anything else, suddenly ruptures and you go from almost no narrowing to 100% narrowing, and that sets off the heart attack. So it can happen to anyone. I've had a 30-year-old vegetarian lady that's happened to. There's an element, I would say, that your time came to have a heart attack. It was predestined for you to do it at St. Mary's Hospital. And the maker decided it really wasn't your time to go. You had something more to do. And so you then went ahead and got recovered. And you're back to actually doing what you need to do. So I would say, listen, thank you very much for talking to us today. And it's a real pleasure to see such a success story. So you're a success story for the NHS care that London can offer to heart attack patients, because London is actually a pretty good place to have a heart attack or a cardiac arrest, because we've got these specialized heart attack centers. We've got great links with the London Ambulance Service. And so you get transported to where you need to pretty straightforwardly. And so then you got the right plumbing sorted out. You had fantastic care at the intensive care unit. You said you actually had amazing care even in rehab. And you have lived to tell the tale, which I'm sure your wife is very happy about.
Yes, and I'm immensely grateful, obviously, for the NHS and the Hammersmith team in at the ICU or the hospital in general. Immensely grateful, obviously.
Well, listen, it's a pleasure to talk to you today. So thank you very much for talking to us, and I won't take up more of your time. And I look forward to seeing you in follow-up in outpatients as we're following you up still.
Thank you so much.
Bye now. Bye-bye.